Hello, welcome everybody. I'm Dr. David Hatfield, the Chief Medical Officer with Hatfield Medical Group, and we're going to talk to you today a little bit about diabetes. And as the title says here, it's Diabetes Tools for a Healthy Life. And with that, we'll go ahead and get started. Again, as I said, I'm with Hatfield Medical Group, Dr. David Hatfield. We were founded in 1969 by my father, Kenneth Hatfield. He has since passed on, but he left a legacy of sons that care about primary care. And we currently have 7 East Valley locations, and we're proud to announce that our 8th location will be opening in Apache Junction this June. We're a primary care office with a focus on adults on Medicare. We provide you with the time you need with your provider. That's something that sets us apart. We aim to give patients the time they need with our providers, and we set up our provider schedules as such that they have the time to be able to spend time with folks. We provide access to care. Same day and next day appointments are available in our clinics. And more importantly, in this day and age, there's a lot of confusion around health insurance and Medicare and all the different products that exist out there. And we like to help folks navigate all aspects of their health care, not just their diabetes, but also sort of the business of medicine, if you will, helping them handle the pharmacy issues, helping them handle deductibles and different insurance plans that they might be trying to be sold by a broker. And so we have people on our team that help patients navigate that part of their health care. We are focused on outcomes, and for us, outcomes really is a synonym for quality. We focus on driving quality, compassionate care to every patient every day. Now, quality to a patient might mean one thing, but to a provider and our care teams in our clinics means something very different. There's a lot that goes into that quality piece. We're going to talk about one of those quality pieces today, and it's diabetes. We are accepting new patients, and everyone is welcome at Hatfield Medical Group. Today, the class is going to last probably somewhere in the neighborhood of 30 to 50 minutes. I guess it just depends on how fast I talk. We're not doing this live, so we won't have questions or interruptions. And I'll try to speak slowly so everybody can understand what we're talking about. Again, what we're going to talk about today is really the blocking and tackling of diabetes. If you have more detailed questions, please seek out your medical provider that's helping you, or your dietitian that might be helping you with your diabetes. It's not meant to replace the guidance that your doctor is giving you. We would want you to consult your doctor before beginning any new exercise or dietary regimen that we would talk about today. With that, we'll go to the next slide, and we hope you enjoy the lecture today and it's informative. Diabetes is a common but serious condition. It's important to understand how it affects the body and steps you can take to help manage it. And today we're going to talk about some of those things that you'll learn. What is diabetes? Diabetes occurs when the body doesn't properly process food for use as energy. And you can see we have a picture of the anatomy here, and the pancreas is the ringleader when it comes to helping us produce insulin, which helps control blood glucose levels. The glucose and the insulin interact. Insulin helps reduce the glucose. And so in folks that have diabetes, we know that this right here is broken. They don't produce enough insulin. And so we either have to figure out a way to help the pancreas make more insulin, or we have to give the body insulin. So in people with type 2 diabetes, the body doesn't use insulin as it should. And so that's where this is broken. There are risk factors for diabetes, as we all know. Uncontrollable risk factors that are outside of your ability to change are your age, race and ethnicity, and your family history. There are controllable risk factors. Our weight, not being active enough, and there are other medical conditions, high blood pressure, to name a few. There are complications from diabetes. I think all of us know a family member or someone or you yourself, if you have diabetes, have probably experienced some complications. Some of these are long-term, and some of these are very, very damaging and expensive to manage if they get too out of control. At the top of the list is cardiovascular disease. That involves heart attacks and strokes. Nerve damage, neuropathy, very common. Eye damage, that's why it's important that diabetics get their eyes checked annually for diabetic retinopathy. Kidney disease, again, that's something that needs to be checked very frequently, even quarterly, every 3 months, to screen the kidneys to ensure that they are functioning at the right level, removing toxins from the body. Foot problems, again, at Hatfield Medical Group, we have a rule that if you're diabetic and you come in our clinic, your shoes are off, and we're going to look at your feet to make sure that circulation, that there's no callus formation, that there's no problem with early formation of an ulcer, and that the pulses are okay, and that you're not experiencing neuropathy symptoms. So feet, we love feet at Hatfield Medical Group. Alzheimer's disease. So dementia is also a long-term complication. So now diagnosing diabetes, and then how do we monitor it to make sure that it's controlled? All of this data now that I'm going to present to you comes from the National Institute of Diabetes. This is not Hatfield, the World According to Hatfield Medical Group, or me. This is National Institute of Diabetes data, and they recommend the following guidelines, and you can see them and follow right along with me on the screen. That all of us are familiar. If you have diabetes or have a family member, you know now that the gold standard is to use the A1C to determine how well we're controlling it and or to diagnose it. So, and you can see A1C, 6.5 or above is diagnostic of diabetes. If you've had an A1C that is 6.5 or above, that is black and white. You are diagnosed with diabetes. There is a pre-diabetic number, and that's 5.7 to 6.4 on your A1C. Normal for most folks is around 5. And then we also use a fasting blood glucose, which would just be a finger stick, or we can do a blood draw. And again, those values are right there. 126 or above, diagnostic for diabetes. Again, that's fasting. If it's not fasting, it's going to be higher. Pre-diabetes, 100 to 125. And then normal for most folks, fasting, is 99 or below. And then we don't see very often the oral glucose tolerance test. We do that in pregnant women, and we don't use it very often in the primary care setting. We usually revert back to the A1C and the fasting plasma glucose. The glucose tolerance test requires folks to drink a really high-powered sugar drink that's frankly pretty nasty. And so if we can achieve the same result with the other two, that's what we use. So that's how we diagnose it. Diabetes, as we all know, requires regular checkups. Diabetics at Hatfield Medical Group are seen every 3 months to monitor all of those things that we talked about. Not just the sugars, but the lipids or the cholesterol, to do the foot exam, to listen to the heart, to make sure that if there's any problems with the medicine or side effects, we want to know about those things early so that we don't let the sugars get out of control. Some of the things that we check on those regular visits, again, are the A1C tests. I mentioned the diabetic retinal eye exam, so important, because if it is caught early, it's treatable, manageable, and we can preserve eyesight. Kidney tests, foot exams, cholesterol and blood pressure screenings, and then dental cleaning and cleanings and exams. Obviously, we don't do that, but we ensure that you are referred to a proper dentist, or that you're getting those exams done, regular checkups and cleanings. So now let's talk about some tips to help you manage your diabetes. There's several things, and I'm sure that a lot of you, if you have diabetes, are aware of many of those things and can probably add some to this list. But an important part of managing your diabetes may be making some healthy lifestyle changes. And here we're going to talk about some of those. Maintaining a healthy body weight, right? And so we always talk about the best way to maintain a healthy body weight is to monitor calories. And the best way to do that is if we bring calories in, we want to know how many calories we're burning. So we bring calories in by the food we intake. We burn calories by the activity level that we do in a day, or exercise, right? And so there's that balance. If we want to lose weight, we will want to burn more calories than we bring in a day, right? And if we're trying to maintain weight, then we want it to kind of be, hey, I burned as many calories as I brought in. And you would be surprised that over a 3 to 6 month period, if we just tip that scale ever so slightly, and we start to bring in less calories and the right kind of calories, and we increase our activity level just a little bit, you'll find that 5 to 10 to 15 pounds that sometimes is the hardest weight to get off starts to move, and we get to more of an ideal body mass index or ideal body weight. So again, eating a healthy diet and staying active is a big part of what we try to achieve with our diabetics. Managing stress levels. We know that when we are stressed, cortisol levels in our body increase. Cortisol levels at abnormal levels are not healthy for our body. They cause us to gain weight, they cause us to be lethargic, and we won't be as active. So good sleep habits are part of that too, right? So we know that that sleep is the most important thing that we do in a 24-hour period. A person will die from sleep deprivation long before food starvation. You can go without food and water a lot longer than you could without one hour of sleep. So sleep is critical to our health as human beings. And then we want you to work with your healthcare team. So part of that might include, medicines, changing medicines, coaching, and just sometimes it's just a positive, kind word that helps motivate a person to get headed in the right direction. Dietitians are a big part of it because all of us living in America need gentle reminders about the food that is healthy to eat and to incorporate into our daily diet. So we talked about this, keeping a healthy body weight. Obesity is a pandemic in the world, and it's certainly an epidemic in the United States. And even if you just think about just little victories and losing a little bit of weight at a time can make all the difference in the dosages of the medicine that you're taking, in the way that you're digesting that sugar that you're bringing in. It can help your joints feel better so that you can exercise more and burn more calories and burn more sugar. So again, can't emphasize enough that striving to maintain a healthy body weight and to get that body mass index at the appropriate number. And again, something that you'll want to discuss with your provider about where that body mass index number needs to land for you. So staying active, and again, I love this picture here because for me, exercise, when it's social and when there's other people involved, when a buddy calls me to go to the gym, or a buddy calls me and wants to go on a bike ride, or my wife wants to go on a walk, I'm so much better at it. It's a win. I can actually wrap my arms around that. Doing it on my own, it's a different story. I'll talk myself out of it in a hurry if I have a better activity like eating a large pizza or watching a sporting event. So grab somebody, and that somebody can be your dog. If your cat will walk with you, walk your cat. Do whatever it takes, but find somebody, and you'll find that you'll be more consistent. That cardiovascular activity that we're aiming for, again, this is CDC recommendation and American Academy of Family Practice recommendation, 30 minutes a day, 5 days a week. And again, start out small. We're little victories, right? Start out by maybe it's a 15-minute walk, and then maybe it's a 20-minute walk. Maybe it's going to the gym and doing really light weights. Maybe it's doing a dance class. It's start somewhere. That's the key to it. Strength training is important too. Strength training builds calories and helps us maintain muscle mass. And so if you have access to a gym, or if you just have access to some bands, you can Google or get on YouTube and look and get those big thick rubber bands and do some things at home, so which can provide strength training. So we all have goals to be more fit. It seems like all of us are always setting goals to be a little healthier and a little more fit than we currently are. Um, and certainly exercising with diabetes can present some unique challenges, and we want to talk about some of those. There are many strategies to help you get and stay active. We talked about set a goal, make a plan, stay motivated, set a routine. Again, if you have somebody you can work out with, that can make all the difference in the world. And be safe. You want to talk to your healthcare provider and make sure that the activity that you're choosing to do is something that your body will be able to perform. Because the last thing we want to do is have you start to engage in an exercise that creates an injury, and then you're set back, 3-6 months, however long, a back injury, a knee, or whatever else, right? We want to, slow and steady wins the race with exercise and activity. So we talked about stress. Everybody has stress in their life, and everybody's just a heartbeat away from having some event or something in their life that's going to create stress. And so we know that stress can release hormones that causes our blood sugar to increase. This can be dangerous for diabetics, right? Because the sugar levels can get to a level that's above the 200 number, and then it starts to create side effects and problems. Again, this easy to say, we put on here, stay away from stressful situations whenever possible. Easy to say, but it's kind of you knowing yourself and what you need to avoid. So being in tune. Stay positive. Try to find at least one positive thing, even in the most difficult times. And heaven knows that during this last few months with this COVID-19, we have experienced some stress. Folks have been stressed. We've seen it in our patients' lives. We've also seen it in our own individual lives as families, as we've seen people we care about wonder if their job is going to come back. They're wondering about employment. And certainly that creates a very stressful thing. But even during those times, we have to find some light at the end of the tunnel and some hope and find something that we have faith in. So the goal is to try and stay positive and stay consistent and keep moving forward. Again, there's lots of different ways that we can relax. Yoga, Tai Chi, deep breathing exercises may help keep the stress at bay. And that's certainly just to mention a few, but there are a lot of relaxation techniques out there. And so again, we can't emphasize good sleep habits enough. Diabetes may lead to sleep problems, and poor sleep may lead to higher blood sugar levels. We know this. We see this in our clinics and in our patients' lives. The key to healthy sleep habits sounds real basic, but we all need reminders of it. I could have used the reminder a couple nights ago when I was just up at 2 a.m. thinking about I don't even know what, probably solving the world's problems that I wasn't going to be able to solve anyway, but I'm up looking at the ceiling anyway. Stay on a schedule. Go to bed and wake up at the same time. Do rituals, do nightly rituals. We try to counsel people to have a routine that puts them in the mood to kind of get to that point where they can hit the pillow and fall asleep. Talk about it with your healthcare provider. There might be some things that we're not talking about here that they might be able to help. You know, as a last resort, sometimes we use medicines to help people move into that improved sleep pattern. Again, we want that to be last resort. Nothing does it better than nature, our natural ability to experience the day, become tired, and go to sleep. So let's talk a minute about insulin therapy. Lots of type 2 diabetics use insulin to control their blood sugar. Some people are on oral agents, but we want to talk a little bit about insulin today. So in addition to all those lifestyle changes that we mentioned, your healthcare provider may prescribe insulin to help maintain your blood sugar levels. And he may actually recommend it as the preferred method for you to use a 1-a-day insulin, or even possibly some sort of sliding scale to control your blood sugars. And there's some different types of insulins that we're going to talk about here today. And if you are a diabetic, you probably are familiar with most of these or might even be on one. So there's rapid acting, short acting, intermediate acting, and long acting insulins. And you can see right there, as plainly as I can see, that rapid acting is 15 minutes after injection. So it works right away, and it peaks in 1 hour, and it only lasts for 2 to 4 hours. So we usually use it right around for meals to control sugars. Short acting, 30 minutes after injection, 2 to 3 hours is the peak time, and then it lasts 3 to 6 hours, and then it's out of your system. And then we use intermediate acting insulins as well, 2 to 4 hours after injection. 4 to 12 hours is its peak, 12 to 18 hours is how long is its half-life, or how long it lasts in the body. So long acting is probably the one that a lot of type 2 diabetics end up on. And it's in the, so think Lantus and Levemir are two of those long-acting insulins that we see. And those work for a long period after the injection, and some say 12 to 24 hours is what they would work. So when it peaks, that's the nice thing about those kind of insulins. They don't peak. They produce a steady state of insulin. So you'll take it, usually it's a nighttime dose of the units, and then you don't have to worry about it until the next night. And you might check your blood sugar during the day to see where you're at, but it's a one-time dose, and sometimes you might take it in addition to an oral agent. Many folks are just on a long-acting insulin, and it controls their blood sugars very well. How long it lasts? 24 hours and more, or more. Certainly the majority of that is from 0 to 18, 24-hour period. After 24 hours, we see a drop off. So oral medicines, and usually oral medicines are the first line. Not always, but oral medicines can be prescribed by your healthcare provider, and again, sometimes in combination with an insulin. And the most common medication, according to the National Institute of Diabetes, is with most people with type 2 diabetes, is metformin. Metformin is a medicine that most diabetics are familiar with. Again, type 1 and type 2 diabetics actually will use metformin. However, metformin is not without its side effects and problems. So you'll want to talk with your doctor about what the best treatment is for you. But metformin certainly is first-line therapy for oral medications. How it works: metformin helps by lowering the amount of glucose made by the liver and helping your body use insulin better. There are other medicines that you'll want to discuss with your healthcare provider. Some of you may have heard of them: glyburide, Actos. There's a whole host of different medicines. Again, we're going to try to hit the highlights today. Metformin is a first-line drug, and then you saw on there the insulins that we use for first-line therapy as well. You'll want to take it as prescribed by your medical provider. You don't want to chase a blood sugar with those oral medicines by testing your blood sugar and say, oh, I better take an extra dose. Again, you don't want to do any of that unless you're talking with your healthcare provider about the best approach. Okay, let's take a minute to review. I think we're under the 50-minute time frame. I hope it was educational for everybody, and you learned something. And just wanted to let you know that these are the references that we use. These are all evidence-based sites that we use to gather our information. Dr. Hatfield, I didn't invent any of the treatment of diabetes. I'm the messenger, and this is where we get the information. And we hope this has been helpful in giving you some ideas or some motivation about how to improve your diabetes. And please talk with your healthcare provider. Again, we're happy to be that healthcare provider. If you would like to schedule an appointment with us, all of our providers are well schooled in the treatment of diabetes and the management of diabetes, and educating our patients and getting them, more importantly, motivated to want to improve their quality of health by lowering the A1C, by doing all of the screening things that are necessary, talking with dietitians, figuring out ways to improve activity, reduce stress levels, improve sleep, all of those things we talked about. Our goal is to deliver quality, compassionate care to every patient every day, and we certainly know that diabetes is a part of improving quality of health in our patients' lives. So thank you for your attention and time today.